Hi, Nursing 6818, Dr. Kim Paxton. This week we're going to be moving into exercise and really looking at exercise from multiple ways of using it as an intervention. So, as my little slide up here says, exercise, some motivation required. Most people don't even view exercise as a means to be healthy or stay healthy or to prevent disease. They just know it's something that they do and that it causes their body to hurt, uses up their time. And for some individuals, they see absolutely no value in it whatsoever. Your objectives this week, you're going to be continuing on with your food tracking that you're doing in Spark People. You're going to move right down into checking for understanding. This week, by looking at the exercise and using the different elements of reading and videos that I have you doing, I'm hoping that you're going to gain a better understanding of how there actually is a balance that needs to occur between exercise and nutrition for a person to stay healthy. We're going to be adding in a stress element, as stress is one of the most significant factors that influences health, secondary to the inflammatory effects of it from what you have previously learned. So, stress is one of our big negative mediators that can come in and affect nutrition and exercise. And how can we modulate exercise and nutrition to control the pathophysiological effects of stress and what they do on the human body? The next thing, you're able to go ahead and appropriately discuss the different types of exercises that are out there. Now, there are several different types of exercises, but in each one is used to help the body in a different way. You are all familiar with cardio exercise. You're all familiar with that. It's all about the heart, it's all about pumping. But there are so many more exercises, and if you look at the relationship of the size of the heart to the skeletal muscular system, that heart is actually quite small and that skeletal muscular system quite large. Can we maximize our actual energy expenditure and maximize our health potential if we increase the use of our skeletal muscles as well as our cardiac component? So I'm not going to answer that question in this recording, but you are going to learn the answer to that question as you progress through the elements of learning this week. Also, this week, you're going to understand the different types of exercise and how you can actually use them as an intervention. And from that intervention, how would you discuss them with your patients and how would you explain to them what they can be doing and should be doing? And then the final one is you understand the pathophysiological effects of exercise for disease prevention, to promote it, and to reverse it. So to reverse diseases. This week, your whole focus is in on exercise and what it is and how do you use it, how do you talk to a patient about it, and hopefully you'll gain some perspectives for yourself as well. The reading and videos this week really will support the learning that I'm hoping for you to obtain in relationship to exercise and expand your current knowledge in relationship to it. The chapter Rootman and LaFontaine on exercise and physical activity, that really sets the foundation of an in-depth understanding of exercise and how it affects the human body and how you can actually use it as an intervention. That leads into the Endelman and Kutzma-Mandel chapter, which gives you a very, very broad overview of exercise and brings in the multiple dimensions of the different types of exercise are there. Pender brings in more of a theoretical perspective in looking at exercise as an actual intervention to promote health. So it kind of ties it all together. Then the last element, I need you to review the CDC physical activity guidelines and take a look at these and what their recommendations are and what they're saying. Of note is that the CDC physical activity guidelines have not changed since 2008, and we are now in 2018. From what I'm reading and learning as I do my explorations to make sure I'm current on my content, that this guideline is currently under review for revision, and it definitely needs to have some revisions to it. But you need to have an understanding of what currently is out there, so please make sure you take a look at this. Supplemental reading, I've got two of them. I've got a interesting article. It's not a long read, but it definitely has got some real power to it for understanding the role of exercise in attenuating unhealthy food consumption in response to stress. Part of what I have found as a nurse practitioner when I talk to my patients about different types of medical problems that they have, or they're coming in to talk to me about their weight gain and now they are obese, when I start getting an understanding, getting that puzzle picture to come together, what I find out is that they're actually eating to control their emotions. And instead of addressing the emotion, they'll escape into food. Well, we're going to flip this a little bit with this article, and it actually looks at if when I'm feeling so stressed, if I just take 15 minutes and go do something that requires activity, can I neurologically make my neurotransmitters work differently and tamp down, I would like to have that candy bar or give me that piece of chocolate cake? Can I tamp that down and can I actually benefit my body by doing so? So I think you'll find the article quite interesting. And then for some of you who really don't have a good understanding about what is strength training, I've got a link here to the CDC. And in this website, the CDC has provided a lot of really cool videos on different types of exercises and strength training modules to help people understand and to help you understand what it is, how do you do it, and what is all involved in it. It's a really cool website. You'll find that this particular one has a lot of information that you can store away and actually use in your discussions with your patients and refer them to. You have actually you have three different videos this week. One is on how does exercise manipulate and change your DNA, which is really, really good. The next one is 23 and a half hours. Um, I need you to really watch this one. It is a good video and giving you a dimension that you may not have thought of. The final two videos are about sitting, and they're both along the same lines. You can choose one or the other to watch, but I want you to get an understanding of what happens when we sit more than we stand or walk. All of these elements of learning that I have you engaging in this week are really going to help set that foundation stronger in you to be able to have discussions with your patients. Remember that the discussion is only as good as you can translate the knowledge that you are gaining in this course. You have a discussion this week and it has 4 questions in it. So as you're looking this over, the first one is with respect to Healthy People 2020 for physical activity, what do you think is going on and have we achieved this? The second one is from the nurse practitioner perspective, what is our role with relationship to physical activity and exercise to working to try and meet the 2020 goals? The third one is comparing contrasting exercise to prescription drugs for the management and prevention of disease. And your final one is tell me about what education you have had up to this point in relationship to the pathophysiological effects of exercise. And be honest, if you've had nothing, say, I haven't had anything, this is the first time, or, I've had it, but it's been anecdotal, it's more of what I gained from doing it myself. Give a perspective out there. And again, with our postings, the first one's due by Wednesday, and then responding back to 2 other people by Sunday. Your challenge this week is more of a survey component. You're going to continue on with your logging. You are to be engaging in whatever challenges that you chose to do. And I've got a survey here based upon what you're doing so far in Spark People. So there are 4 questions. They are each worth 3 points apiece. You can take it a second time if you want to, if you don't like how you responded after you submitted. But it's kind of like a pass-fail. Please make sure you're providing me with information to the questions. If I find that your answers to the questions are very brief, superficial, I'm going to take points off. I need you to really reflect into the question and provide me with solid information about the experience, and having you really reflect on it strongly. Those brief responses don't really answer the question. It's kind of like going true, false, and that's not what I'm looking for, and that's not what your patients are going to look for when they ask you questions similar to what I'm asking you. Your journaling this week, you've got 5 questions that you're going to be answering in relationship to what you're doing inside of Spark People. How is the food monitoring go? Talking a little bit more about what challenge have you gone into, and then going more in depth into understanding what your thinking is in relationship to how you could possibly use this type of a technology to assist your clients. When you're embedding your screenshot, you can embed it right on your Word document. So when you do your journal, embed your food tracking right onto the Word document and then go ahead and submit it. I'm doing my food tracking right along with you and have found that it is challenging at times, especially when I get very busy during the day. I will record my food in the morning as I'm putting together my breakfast and my lunch. And dinner is where I seem to have most of my problems because I get engaged in other things at home and have forgotten to do it, then have had to go on back in and do it again. And as I reflect upon this, this is the same type of problem that my patients will have. So, how am I working to overcome this? What strategies can I use? And if you've got a strategy, share it. And you can actually add it as like an addendum in your CLT, or you can add it as an addendum, like extra information in your journaling. I'm hoping that you're gaining experience and understanding in relationship to what it is to really make a lifestyle modification and how hard it is to really be able to do this and be successful at it. Food for thought. Food is the most abused anxiety drug. Just think about that. Exercise is the most underutilized antidepressant and treatment that we have today. Why aren't we using it? Why are we turning to drugs for the management of issues and concerns that patients have? Ponder that one. I'll be seeing you online. You guys have a great week.